The nation of Guatemala is home to more than 13 million people with a rich history extending back to the great Maya civilization. Today, Guatemala struggles with major challenges in healthcare and education. But now, doctors from the University of Colorado and the Colorado School of Public Health are taking on the task of improving health in the densely populated Central American nation. The effort is funded by a Guatemalan banana grower who recently gave $1 million to the Center for Global Health, part of that public health school. The donation will fund a clinic, laboratory, living quarters, and conference center on a banana plantation in the impoverished southwest corner of Guatemala, an area known as the Trifinio region. The medical complex will provide care for the plantation's 3,000 workers and for the nearly 24,000 villagers nearby. In July, a University of Colorado medical team, led by Dr. Edwin Asturias, traveled to Guatemala to assess local health issues. They tested blood for signs of anemia, an indicator of malnutrition. They took stool samples to search for parasites. They also did routine physicals and minor surgeries. Fourth-year medical student Darren Iblovi collected blood and stool samples at a school in the tiny village of El Pomal.
We're also screening children for parasites and anemia because those are two diseases that are very common here and also inhibit normal growth and development, and so are very important and related to those early development interventions that we're working on.
While Darren conducted tests, fellow medical student Lauren Miner talked to parents about the importance of reading to their children. $1 million donation was made by the Bolaños Foundation, operated by Fernando and Gustavo Bolaños. The family owns Agro-America, a Guatemalan company that runs banana and palm oil plantations. Gustavo Bolaños is the chief operating officer.
In Guatemala, it's a country that we have a lot of inequality and a lot of poverty. The government hasn't been able to really cover the needs, the basic needs of the population. We as a private company see all the needs of our people. Biggest problem that we are facing is education and health. And at the moment, what we are trying to do is to, by next year, to build infrastructure to be able to have clinics and staff from the University of Colorado to come here and to help to these people. We are very good at what we do in this agriculture business. But we have no experience on running, helping hospitals or clinics or whatever. So we need to have a partner.
This family illustrates the challenges facing healthcare workers. 10 of them share a single room in a rickety house made of metal sheets. Their floor is dirt, and they use contaminated well and river water to wash themselves, their dishes, and their clothing. Ducks, chickens, and turkeys wander the house, defecating on the floors. The children run around in bare feet. Fernando Bolaños is CEO of Agro-America. His father grew up poor and urged his children to never forget the plight of those in poverty.
Even though the low level of education that we have, they're very smart, they're very appreciative, they're very hardworking, but we have to provide them or help them get the tools that they need to come out of this cycle of poverty.
Looking for a place that we could actually bring our expertise in health to be delivered for populations in need. Not coming with predetermined ideas of what to do, but exploring from the community what are their needs.
The CU team worked hard in often difficult situations. The weather was hot and humid, and the extreme poverty often overwhelming. Yet despite that, they came away energized about their work, the people they met, and the future.
What struck me the most, and it continues to amaze me, is this sense of community that these families have. It just really helps you connect with these people on a more personal level and helps to understand that what you're doing has a purpose and has a deeper meaning. It really kind of inspires me to come back.